Hi everyone. I want to talk today about something that often comes up for me, and that is around the difficulty of making medical decisions. It always seems such straightforward until it isn't. And I just want to talk about some cases that have come up fairly recently for me and just to point out this difficulty. The one case is actually a family member who's had cancer when he was very young, maybe in his 20s, right at the back of his nasal area. It's in the sinuses in the back of his throat there. He had a cancer which was treated amazingly successfully. I think he had radiotherapy. 30 years later, he's had a recurrence. 30 years later. Incredibly unusual area, very, very difficult area. He's had three specialists have a look at it. Three specialists who work in very, very different ways. Each one of them is a specialist in his particular technique. And they're all making claims that they can treat it, but they're all very different. The interesting thing is that he's now they found somebody who's psychic, very, very psychic, is used by the medical profession because he can make a diagnosis and he seems to know how to advise people, which is kind of interesting, isn't it? On the one hand, three specialists they are top world experts in particular areas, but all different, all making specific claims. And now the family's gone to a psychic to help them to make the decision. I mean, for me, that's such an interesting space, that area there where, experts involved, and yet there's still another way to make a choice. I was thinking also about, let's say, COVID, where experts still are making claims that the vaccine is astonishingly successful and saved lives. And then other experts, equally expert, professors as well, incredibly knowledgeable, are making exactly the opposite claim. Well, what came to me over the last few days was midwifery. The two cases came forward for me. The one was a very experienced midwife dealing with a delivery that seemed absolutely straightforward. Everybody was positive. The woman involved was positive. The midwife felt that there was no problem. And yet, as the head was coming out, crowning, the contraction stopped, just like that. And there was some moments of absolute panic in terms of should she be rushed to the hospital. But the midwife had a lot of experience and she knew that sometimes this happens, and she was confident that contractions would start, as it did, and the baby was delivered. Another case with exactly the same situation, where the baby seemed to be struggling to come out, and the midwife persisted and waited and waited. And eventually the baby did appear with a cord around its neck, dead. So, this is the kind of thing that often comes up in terms of experiences, and in both cases, the midwives are very experienced. Doctors warn mothers not to go to midwives because they can be a much better control if the person is in hospital and has a delivery in hospital where there's care and any problem can be taken care of. So this is the confrontation every single woman has, and they have to make a call on it. Are they going to trust a midwife with a lot of experience, or put their hand in a doctor who claims that they can be in charge, they can do the delivery, no problem, much safer to be in hospital? Is that true? So that's a problem that we face on many, many different fronts, whether we go on experience, our gut feeling, or allow the experts. Now, one must understand what's happened with these experts. These experts also have got a lot of experience. They have got a lot of science to back them up. They got a lot of science to back them up. They really do. And they are feel that they're totally in charge. They can induce you, and they can do a cesarean section if necessary. And that's based on specialists coming together, developing protocols. And for every gynecologist and obstetrician, those protocols are important, because the protocols guide them what they can do and what they shouldn't do. And they must follow protocols, because if they don't follow protocols, they can get into serious trouble. So if a doctor runs into that situation where his experience may suggest that he should go in this direction, but the protocol says this, he will often follow the protocol. So which one is going to give the best results? And that's what I wanted to bring up today, because I came across a report, and I'm going to read the report here. It was a big report published in peer-reviewed journals, where they did a meta-analysis, 44 studies they picked up that involved over 1 million women, 1.397 million women were enrolled. That's a big coverage. And what they found was interesting. They said that midwife-led care carried a lower risk of unplanned cesareans and instrumental vaginal deliveries, a lower risk of having to augment labor, lower risk of epidural analgesia, lower risk of episiotomies, and active management of labor in the third stage. Women who received midwife-led care had shorter hospital stays, lower risk of infection, lower risk of manual removal of placenta, lower risk of blood transfusion, and lower risk of intensive care. Furthermore, the neonates, the babies, delivered under midwife-led care had lower risk of acidosis, lower risk of asphyxia, choking, lower risk of having to be transferred for specialist care and ICU admissions. There was lower risk of hemorrhages and tears. Conclusion: midwife-led care reduced childbirth interventions with favorable maternal and neonatal outcome in most cases. So, I mean, that's telling you, that often what seems true, that protocols and hospital births and care of that it's safer. It's actually not, because the trouble is that, first of all, obstetricians often tend to induce labor before birth, before natural, so that is already a problem. And then there's always interference factors which come in, hospital infections and things like that. So it doesn't work. That what seems obvious, that having a birth in the hospital is much safer than having the birth at home. It's not true. Actually, science shows it very clearly that it's not true. So that's the reason that I keep pointing to the complexities that we have in medicine. Even though it's based on science, one must remember that science doesn't give you the experience that people have actually. That it's often the experience, the gut feeling, the sense of knowing, the relationship, that's much more important in the end than science and protocols and following through on that kind of way of seeing things. So just look at your own life, and be careful, because it often looks, when you look at it from the intellectual point of view, as I keep pointing out, it seems like straightforward. But you see, life is not like that. Life is always complex, because we're dealing with not just with what I call flat earth approaches. We're dealing with the matter, energy, information, body, emotions, mind, spirit. We are much more complex than the conventional scientific way of seeing things actually is. The conventional model looks at the human being as a machine. And obviously we're not a machine. We're very, very complex, functioning on multiple levels. So that to try and base outcomes on past doesn't work in that particular setting. So be careful how you deal with your life. Be careful of ignoring your own feelings and your own gut and following the natural way that I keep pointing to. Science is beautiful, amazing, but it has its limitation as well. So, but choose between the limitation of science and the limitation of your own experience. You can do both. I love both, actually. That's the way to live.